We're going to switch gears a little bit now. And we noticed that several of the previous presenters had talked about platforms. So the next couple of presentations are going to focus on platforms. The first is, our speaker is Dr. Milton Chen, who's the Chief Executive Officer of VSEE, that's VSEE. He obtained his PhD at Stanford, where he became the co-author of the XMPP video standard, which is probably if not the state-of-the-art video standard, and as such has been an instrumental leader in using video for a variety of technologies and of current interest for telemedicine. So I note that VSEE, for example, is the provider of choice for telemedicine applications ranging from NASA's moon program to most recently the nation of Qatar, which, like Korea, is a single payer system, and so has the ability to roll out with government oversight to all of the citizens simultaneously. So with that, Dr. Chen.
Thank you so much, but I'm really honored to be here with you. I guess, will you share the slides or should I share the slides?
It's probably better if you run them yourself if you can.
Okay, great, okay. I can apologize, my PowerPoint's a little bit slow. So.
Okay. Christine, do you have Dr. Chen's slides that maybe you could pull up?
Ms. Yesel, can you please pull up Mr. Chen's?
There we go.
Oh, yeah.
Good to go.
Okay. Okay, I apologize.
No worries. Go ahead.
Okay, great. Okay, thank you so much again. So what I want to talk about today is the idea of turning clinicians into superhumans in productivity. And I'll just share momentarily why, unless you solve that, I think telehealth will never able to scale. Can we go to the next slide? So we're pretty proud to say we're about 14-year-old company who's been doing telehealth implementations. We're pretty proud to say for the last 8 years, 100% of video call and telehealth from NASA International Space Station are done by our software exclusively. This one is showing you the very first time the SpaceX were docking with the ISS. Again, they ran VSEE in the SpaceX cockpit after coordinating with Houston at the space station. And what we learned for the last 8 years is, the idea is the system, whatever you have, has to be very robust in there. Again, when you deal with these for NASA, and by the way, so because there's no backup, right? There's no Zoom or Microsoft in space. This is only VSEE. If we go down, astronaut cannot do video call with Earth. So you can able to have a very robust systems are critical. Then the other thing is you'd have something that a near zero training. What I mean by this is the astronauts are extremely busy, just like physicians and nurses. Again, they really don't have any tolerance for these sort of complex UIs and so on. Another thing we learn is, so we're transitioning from the space station, and they actually want us to create their moon missions as an astronaut plan to go back to the moon in a couple of years. That means you must have a secure architecture, able to deal with a very complex environment, and able to change within this ultra secure and complex environment. And then one of the tricks we use this is the idea we embrace, I don't know. What I mean by this, right? Whatever software you have to be so flexible that you're able to configure these once you understand your scenario. And the last concept is the idea that astronauts are like superhumans in terms of physicians and nurses, then often they actually demand a tool that can match their level of productivity. Can you go to the next slide? As George mentioned in the intro, is we're proud to say is we have the country Qatar, they pick VC as their countrywide exclusive telehealth platform. And one of the reasons they picked VC was using our flexible configurable architecture, we allow them to a single platform to scale across the entire country from pediatric to palliative care, everything in between. You could have like thousands of the telemedicine cards from stroke, ICU to direct to consumer in there. Again, part of our approach for this is the idea is not just have a software, but have a software able to rapidly deploy, configure into whatever workflow you need. Could go to the next slide. This is an example is if you go to the Tesla car factories, they have on-site clinic that we designed for them. So the idea is the employee do not need to leave the car factory. They could still see a doctor. So they use our software to do things like remote physical exam. You can have digital stethoscope, also medical devices stream. What we find is if your telemedicine is only doing video call like a Zoom, then from the physician, you're limited by able to stream medical devices. So that's a key capability to able to achieve efficiency. Could go to the next slide. So our company is, we are primarily serving the US client base. We're used by also the biggest enterprises in the US, but we also have a lot of international work. So I personally have been to Iraq 3 times. I've been to Syria. I've been to over 50 countries doing the in-the-field telemedicine deployment. So this is, you'll see our work in Iraq. We designed a suitcase, take it to the refugee camp. So there's a lot of American physicians that see the patient in Iraq. Then the picture on the right is we did a lot of telesurgeries in Iraq. In this case, the surgery done by the Iraqi surgeons, but they communicate with the American surgeons so that they could discuss very complex cases. Again, what we create the environment is for the physician, for the surgeon remotely, they could see all sorts of different views from endoscope to camera that mount on the surgeon's head. So this you can have a very rich situational awareness as you're working with a local surgeon to discuss, do a complex case. And we're proud to say we did the very first liver transplant in Iraq using our architecture. Can you go to the next slide? So I was mentioning we do a lot of these for international work. So this is for one of our sub-projects we call Solar Vaccine Cooler. So it's designed using AI and machine learning to take a normal cooler, connect with solar panel to able to dynamically control the range. And we take this package up with our telemedicine suitcase. Again, this thing is make it really easy and simple way to able to have a way to make sure the medication, the vaccine are temperature control, plus the medicine, plus the telemedicine equipment, you can run these for pop-up clinics. In fact, we'll be making a trip to the Philippines in August, deploying a number of these across the Philippines so we could actually deploy some of the really hard to reach locations where some of the electricity is not as stable. Can you go to the next slide? So one of the things that most people, when they think about telemedicine, they think about doing video conference calls. We find is if that's your model, you have a fundamental limitation in provider efficiency. So this is one of our mega project in the US where we bring almost 1,000 American specialists, sprinkle their expertise into several hundred federal qualified health centers. So the idea in this case, let's say I'm a physician in these rural clinic. I could just take this case, wrap into our VC platform. I could just submit it to a cardiologist or rheumatologist or dermatologist. Then as you imagine this case will wrap around this network of clinicians, then they could discuss these cases and send it back. And this model allows the specialist to be a lot more efficient use of their time. Now they could jump on the video call as necessary, but what we find is if you do, let's say 100 of these cases, only probably less than 10 that require video escalation. And now this is a model where now you can bring these specialists very efficiently to all sort of these more rural clinics where they don't have specialist coverage. Could go to the next slide. So what's behind the VC is, so our basic approach is to say, look, if you want to allow physicians to be superhumans in productivity, you cannot build a software before you meet the physician, the nurse, right? Because whatever you're going to build is going to be slightly off. So what we've done is we spent over 500 man years of engineer work, build up all the possible building blocks you might need. And then what you could do is just imagine almost like a Lego building block. You could shuffle them together. This will allow you to able to achieve whatever the workflow you want. So for example, I'll give you a couple examples. Quest Diagnostics in the US, their COVID solution ran on the VC nationwide. We were able to go live for them at the beginning of COVID in 4 days. You can imagine, how do you support the largest laboratory in the US across all 50 states? How do you roll out in 4 days? Because we didn't have the right, no coding was required. We just take all the building block we have. One of the challenges they have hundreds of nurses do COVID appointment. So what they do is they go on the VC platform, map out all the hours they'll be working. So we create a unified view, make it super easy for patient to book appointment. So another example is we have an Uber-like routing system, just like using Uber, order a car. You can have the system where patient come in, you route to a pool of next available physician. Really easy to distribute these. Again, just all sort of we find is having this sort of building block approach. This will allow you to, again, whatever you need, quickly configure without programming, you could achieve what you want. If you go to the next slide. So why do you want to make doctor into telehealth, into superhuman? What we find in the last 14 years doing telemedicine, we have done literally thousands of deployment. We do millions of visits many millions of visits every single month through our platform across like the biggest enterprises across the US. So we find in general, patients love telehealth. You don't need to persuade patients but doctors are resistant to telehealth. If you don't solve that, you will never achieve adoption. The first one is doctors in general, they are worried about competition and the lack of reimbursement or the clarity on that. So that's a government policy. You have to have that. Otherwise, you could do pilots, but you cannot scale up. Then the second thing is, when you do telemedicine, if you're using your Zoom or Microsoft Teams or do a video conference as a model, you increase physicians' work. You lead to them burn out, right? Literally just way too many clicks for them to do a telehealth. By increasing more work, they say, why should I care? So this is our approach is you have to make sure the physicians able to achieve superhuman productivity. That means they could see patients with better clinical outcome and with less work than in person. If you cannot achieve that, you can't do it. And through our experience in using the astronauts example, they typically have this no tolerance for nonsense type of things, right? There's actually no reason why you cannot create a workflow to be able to make physicians really happy when they're. Okay, go to the next slide. So the way we approach this, I was mentioning a little bit earlier, the whole idea is you must empower the physician and nurses to create their own workflow without programming. Right? So today what happens, right? Let's say you're a physician, you have this great idea about how telehealth should work for you. Then you have to go, get some IT and programmer to do this for you. Next wait 9 months or a year, and what they build sort of what you want, but it's just not quite. So ended up is all the innovation in the physician's head is just drained. It's become like a black hole, like just suck them out of the system. So our approach is say, you should be able to empower the clinician to create the exact workflow they want without programming, right? No programming is required. They can still get exactly what you want. If you could do this, now you empower every physician, every department to get what they want. And this is how you can allow them to become superhumans. Can you go to the next slide? I'll just give you an example. So we're doing a lot of stuff for Ukraine right now. So when the war initially started, we were approached by the Ukraine Ministry of Health. They want us to create a dispatch plus telemedicine system. The dispatch model after the US 911, I mean, anyone could make a request, then we'll pair out with the telemedicine council. We were able to roll this out nationwide in 72 hours. First 24 hours, configure the VC building block, no programming. Second 24 hour, we translate everything to Ukrainian. Third day, we actually get a pool of Ukrainian speaking dispatcher, get them trained up, and we start operating. Again, so by having this flexible approach, you can again just create also the really interesting workflows, again, taking the programmer out of the equation. You can go to the next slide. Again, really, really thank you so much for the opportunity. I'm honored to be here to share that thoughts with you. Again, thank you so much.
So thank you, Dr. Chen, for an extraordinarily interesting presentation. And we're about to hear from a Korean doctor around some of the platform issues, but because you've done a nationwide rollout in Qatar, could you share for this audience what you've learned from that in terms of how it is to work with a complex single player system, et cetera?
Yeah, I think the number one thing we learn is the sense of humility. Right? Like for example, we did a lot of work for the biggest hospital in the US, all these things. Of course, when you go to Qatar, it's a different, right? Culture is different, the physician, a lot of workflows totally different in this. So it really is just about could you take this platform very rapidly localized to the local environment where it's almost like, it's not like a bunch of Americans telling Qatar what to do. It's really empower the local physician to create their own things in there. So I guess I think that's probably a single one behind our success doing countrywide deployment. Again, if you look at the country, there's also the interesting use case we didn't even think about in there. So now they're actually doing these ultra interesting things.
Thank you.